Hi, this is Harry Margolis, host of Risking Old Age in America. In this podcast, I talk with Robert Espinoza, the founder of the CareWorks Project, about the work he is doing to improve the quality and delivery of long-term care. He points out that our current system was designed at a different time when care was seen as an extension of hospital care. Now most people are receiving care in their homes, and the system needs to be revamped. Here's our discussion. Robert, thank you for joining me today.
Thank you for inviting me, Harry.
So I wonder if we could start by your explaining your journey to what you're doing today, which I understand is launching a new project.
Yeah, absolutely. So I have spent probably the last 16 years working in the long-term care sector. So I began working for a national organization that ran a senior center in New York City in 2010. I was interested specifically in how governments should support older adults and some of our most marginalized older adults. And then I spent about 10 years leading the think tank side of an organization that focused on improving jobs for direct care workers. So home care workers and nursing assistants who support millions of older people and people with disabilities in various settings, right? And as part of that work, I learned that this is an issue, the long-term care crisis, let's call it, that is
Mm-hmm.
affecting millions of people, whether you're a family caregiver, a person receiving care, a direct care worker, or an employer, right? You're seeing a growing need for long-term care in various settings and a society that isn't able to deliver it with quality and sufficiently, right? And so I developed a civic enterprise called the CareWorks Project that I launched last month, looking closely at,
Congratulations.
thank you. It's really an attempt to try to reimagine solutions in long-term care. So how do we work with leaders in the public and private sectors to reimagine how we talk about caregiving? How do we develop initiatives and programs that better support workers and care recipients and employers? How do we work with foundations and impact investors and the business community to make sure that our economy is as strong as possible and that whatever they're contributing to this issue, this broad set of issues that form long-term care, that they really resonate with what society is dealing with today? I think one of the core premises, Harry, if I can share, is that the system that we have in place today for long-term care, it isn't working, right? I mean, we see
Mm-hmm.
this anytime we need care for ourselves or our loved ones, but it was also designed in a very different time. I mean, when you look back at the early 20th century, it was seen as an extension of hospitals for the most part. And it didn't imagine the demographic growth of older adults, much less the diversity of issues that we're seeing in today's economy. And so it's really saying, let's look at the solutions that are needed today and how do we build toward a better future.
So that's interesting. So yeah, I guess if you go to nursing homes, they look kind of like hospitals. Um, but I think there's also a history of like almshouses too, right? That
Hmm.
and I'm not sure how they connect, but that either people need medical care or society is going to kind of do the minimum for its poorest members.
That's right. I mean, I think in the history of, let's say, home healthcare and nursing homes, what you saw was really just an extension of hospitals. And so people, they were often older, they were very sick, they had severe disabilities, and they were institutionalized into what essentially looked like hospitals. And nursing homes, I think, developed and in many ways still retain that aesthetic of a hospital. And it's not what people want, right? When you ask in most surveys, how do you want to age, in your final chapters? How do you want to live with dignity? They say in our homes and in our communities. And for people who still need 24-hour skilled care, the best option might still be a nursing home. They certainly don't want to live in a setting that looks like a hospital and treats them like a patient, right? And so I think part of what we want to do, and I hope society is thinking about this as well, is move our ecosystem of long-term care toward a more person-centered, humane reality, right? So that people feel like they're living at home regardless of where they're living, and that the care they receive, whether it's from a direct care worker or a family caregiver, that it's of the highest of quality and that it really respects the independence, the dignity, and the quirks and personal traits that we all have, right? I think that's the ideal.
So how do you balance the ideal and the cost? I mean, I always feel like there's this, irony is the right word, but direct care workers are not paid very well and don't have very good kind of work benefits. On one hand, on the other hand, they're really expensive for families to pay for, and
Yeah.
most families can't afford it. So how do you deal with the cost and the ideal?
I mean, I think the cost is probably the biggest issue facing the long-term care system, and I would reframe it at least in the way we look at it in terms of the affordability of long-term care, right? When you look at the annual median cost of long-term care, it can range anywhere from $75,000 a year for personal care at home, all the way to $170,000 a year for a private room in a nursing home, right? And when you consider that many people in this country cannot afford more than 1 or 2 years on any end of that spectrum, what you're dealing with is really just a disaster, right? A financial wall that families and individuals face when they realize, oh, I start to need paid care in my home or in my lives. Also, when you look at the figures, what we spend in this country, the most commonly cited reader's estimate is that the US spent about $563 billion on long-term services and supports in 2023. That's an incredible amount of money that's spent. It's also an incredible part of
Yeah.
our economy. And we don't think about long-term care as being both a contributor to the economy and also an expense, right? States do because they have to balance their budgets every year and they see what LTSS is costing. But what the cost that is not usually accounted for are all the unpaid costs, right? It is
Hmm.
emotionally and financially expensive for a family member to provide unpaid care to a loved one. You often see, for example, women leave their jobs or cut their hours in order to care for a parent who's aging, an adult child with disabilities, etc. Direct care workers also pay in other ways, right? If you're only being paid $12 to $15 an hour and you're living a financially insecure life, you're going to rely on public assistance, and that's a cost that comes to our government and to taxpayers, right? And and poverty is expensive. It costs in other ways. If you don't have access to health coverage, it means that you're going to have expensive medical costs that get covered in other way that don't get covered in other ways,
Hmm.
and it ultimately costs the family in ways we can't even describe or accumulate. Yep.
So you're saying when you talk about the caregiving economy, I forget the exact figure, but the 463 billion spent, but that's not including all these other costs. Some of them just costs of people making sacrifices, but
Hmm.
other actual costs such as Medicaid paying for health care for a direct care worker.
Yeah, absolutely. I mean, the $563 billion cost, that includes spending on home care, on nursing homes, on assisted living expenses. It includes other forms of long-term care supports, and it includes programs like Medicaid, where it's applicable, Medicare, private insurance, and out-of-pocket spending, right? But if we define cost more broadly, it doesn't count, for example, the cost of the direct care worker needs to, for example, to take on multiple jobs to stay financially afloat. There's a cost of not being able to spend time with your family, right? The cost of not having health coverage ultimately becomes a medical cost years later when something emerges that you could have prevented, right? And I think that those are the costs that we don't cover in fixed expenses in that figure, but in fact, people are living through every day and they can speak and testify to in very personal ways.
So when you talk about the caregiving economy, you're talking about all of these costs.
Absolutely. I mean, I think in just in very strict terms, I'm talking both about the expenses that our government puts into long-term care and also people out of pocket. But it also includes the emotional and opportunity cost. Yeah.
And I guess we're also talking about the economy, all the unpaid care that people provide to some extent keeps the economy going, right? So that um, if uh, if someone is caring for a family member, there's a cost because it's probably competing with their work, but it's allowing other people to go to work.
That's right. That's right. I mean, I think the figure there is that family caregivers provide in unpaid care over $1 trillion of support, right? And they're doing it unpaid, right? They're actually supporting a father with dementia through an emotionally grueling process for both of them and the entire family. And it's care that if it was provided by a professional and they were paid for, would actually be quite expensive, right?
Yeah.
And then there's the reality that oftentimes, I mentioned that women will cut their work hours and leave their jobs, and of course, men do it as well. It's just a reality that women, of course, share the disproportionate burden of, right? But what you also see is another statistic that 40% of family caregivers are men, and yet men are more likely to not talk about the emotions that come with caregiving, right? When you don't talk about an emotional issue like caregiving, like losing a loved one, etc., that often leads to diagnoses of loneliness and mental health issues and depression, etc. And it can lead to worse, right? Men have the highest suicide rates among the oldest parts of our populations, right? And so these are all ways in which our society suffers because we don't explicitly deal with long-term care in a way that's well resourced and strategic.
So that's part of what you said earlier, that we're in a caregiving crisis
Hmm.
already.
Hmm. Yeah,
And the need for care is going to double over the next couple decades as baby boomers age.
that's right.
So so if we're already in a crisis, I guess we're going to be in a double crisis pretty soon. Um,
Yeah,
what,
I
what
feel
can
like
we
it's
do to prepare?
Yeah, absolutely. I mean, I think that we're going from a crisis potentially to a catastrophe, right?
Okay.
Unless states and our federal government invest, strongly in the long-term care system, right? I want to be hopeful. I also want people to feel like there's a way in which, we can all play a part in making sure that the long-term care system is properly resourced and designed. I mean, I think what you mentioned, for example, is that one, we're seeing a rapidly growing demographic of older adults. I think the most commonly cited statistic is that every day 10,000 people turn 65. And
Mhm.
that percentage of people 65 and older is one of the largest segments of our demographics, right? And we're seeing this
Yeah.
all over the world, by the way. So we're seeing the aging of this country, but also the rapid aging of many parts of this world. We're also seeing care become more complex and acute. So we're seeing conditions like dementia and other forms of Alzheimer's. I'm sorry, let me say that again. We're seeing, for example, a rise in the rates of Alzheimer's. We're seeing a rise in long COVID cases, which is a new
Mhm.
kind of
Mhm.
reality that people are facing. We're seeing cardiovascular disease and diabetes and other conditions. And if our care system isn't properly resourced, or let's say our workforce isn't properly trained, to support people with such needs, then it means that those of us who develop them, and many of us will, right, we're not going to get the support we need. And so the other statistic I want to mention is that, when you look at there's also a crisis in the number of job openings that you see in direct care. So these are
Mhm.
jobs like home care workers and nursing assistants and residential care aides. These jobs are super critical for people who rely on that support, and yet they are often poverty level jobs. And turnover rates hover between 60 and 100%, often within the first 90 days. So these workers stay in these jobs. They often for no longer than 90 days in many cases, right?
Mhm.
And they leave for modestly better paying jobs in retail or fast food, right? And when you look at how many job openings will need to be filled in the next decade, it's more than 9 million, right? Well,
Uh-huh.
how will we fill those jobs unless we improve the quality of it? And so what's in front of us is a reckoning. I think that the public and the private sector needs to imagine jobs that are salaried, that, are high quality, where training and advancement opportunities are widely available to workers. So those job openings are something that workers want, they're not just paychecks and basically ways onto different jobs. Yep.
So how do we do that?
Yeah, it's a good question. I mean, I think certainly the broadest solution that I think we need to head toward is what Washington State is doing and what many countries, what several countries are doing in Europe, which is we need a national social insurance program, a federal social
Mhm.
insurance program that properly resources long-term care. It would make long-term care more affordable to families, so it would help them cover the cost of long-term care, something similar to Medicare, but for long-term care, right? It would
Hmm.
also be designed in such a way that it would create quality jobs for the workforce. And so instead of our current system, which incentivizes employers and others to really provide low-wage jobs that
Right.
workers don't last in, this would be a system in which compensation would be high, where career opportunities would be flourishing, where training would be strong and it would be modern and relevant to today's learner. And it would be a system that would support family caregivers, right? Any of us who have gone through a system where we have needed to facilitate care for a loved one, and we ourselves have gone through the emotion of what that means, knows that there's no script to long-term care and family
Hmm.
caregiving, right? And so a properly resourced system would think about all the needs that family caregivers need, and it would pay for their unpaid care, right? So it wouldn't be coming out of their own pockets or not even
So would
captured.
would it pay the family caregivers directly?
That's right. I mean, I think the family caregiving sector has done a great job of enumerating all the policies that are needed, and we're seeing this at the state level and at the federal level. But absolutely, it would pay. Perhaps there would be a tax benefit, or there would be some kind of a benefit that family caregivers would receive just to support their loved one. There are currently, for example, states have consumer direction programs where if a loved one is supporting a family member, they can apply to be covered by the state and paid a very modest amount. And yet, most people are not aware of their consumer direction programs in their state, and the state doesn't really cover that much for the family caregiver. So that would become a much bigger part of a fully resourced long-term care system.
Currently, is that only through Medicaid, or are there also non-Medicaid programs?
Most of it, the vast majority, is through Medicaid, and that's the challenge as well, Harry, is that Medicaid is vastly strained. It's incredibly strained. It's
Right.
under-resourced in most states. It is a politicized issue. So half the states in our country, invest in Medicaid. The other half are pulling money from that program. But
Hmm.
unless you have an alternative financing mechanism, whether it's Medicare or something else, then what pays for long-term care? And right now the answer is families are paying for it. And so I think that's what brings me back to the solution that we need our government and the private sector to step in.
So, if it were like a Medicare Part E, it would be national,
Hmm. Yeah.
and I think probably we're not going to see that happen in the next 3 years. Um, and you mentioned Washington State, which has a small public long-term care insurance program. Do you think this is something the state should get into? Since federal government at least is not going to act anytime soon.
Yeah, absolutely. And I think that states are beginning to explore this. You're seeing ballot initiatives, you're seeing policy proposals, you're seeing working groups come together to try to figure out what would a design system look like that maybe models after Washington State and also is aligned with a state's unique needs. How do you finance it? How is it delivered? It can't be universal in the sense that it covers every single expense to its full expense, right? And so what gets left out, there needs to be some trade-offs there. And I do think that we're seeing more of that. Mark Cohen, who is one of the leading experts on this issue, released a report that was funded by the SCAN Foundation last year on policy options for financing long-term care. And certainly social insurance programs are an option, but there are other ways to finance long-term care in a better way. And what he has found is that mostly it has been innovations at the state level that have experimented with what's needed. But I think it needs to be federal. I think it's weird to live in
Hmm.
a country where your benefits don't travel with you, where we live part of the year in Jersey City, and if New York had a program, but New Jersey didn't have a program, that just seems unfair. It's 5 miles away, right? And
Hmm.
so why should it be a piecemeal framework, which is what we have in long-term care now? Why don't we create something that's national, that's federal, that doesn't vary by where you live?
So another question about this kind of national insurance for long-term care is, would there have to be a funding period? Like, would you have to pay in for 10 years or something like that before you could get a benefit? How do the numbers work otherwise?
Yeah, I mean, that's one of the financing design questions that I think states like Washington State and others deal with, and also other countries, right? is presumably you do pay in for a certain number of years. And once you're vested, then you have the actual amount to be able to pay for long-term care. Otherwise, how is it financed, right? You could also create a tax that, taxes a certain number of people, a certain percentage, and it funds that way. And there are trade-offs with all of these approaches. It's honestly less of my expertise. I think there are economists and actuarial analyses that can step into this, and talk about those mechanisms. And certainly the people in Washington State can speak to this. But I think it's one of the questions that you have to grapple with at a higher level is, do we believe that long-term care is a public good that should be part of the social contract?
Mhm.
And if so, then we need to invest in it and make it affordable for families. Yeah.
Well, I think that's a long-term debate in the United States, right?
Hmm.
I mean, the old idea that everybody was responsible for themselves and they were an independent actor
Hmm.
is very American, right?
It's very American. It's very this notion of individualism and meritocracy, and maybe it's very Western as well, Western Europe. But it's this idea that people hold this deeply held mindset that you are responsible as an individual for your lot in life, and if you succeed financially, it's because you worked hard, and if you didn't, it's because you didn't, right? And it
Right.
ignores the ways in which the systems that we're born into, oftentimes the zip codes we're born into,
Mhm.
dictate the trajectories that we have all the way from birth through elementary school, middle school, high school, and beyond, right? It also doesn't really play out in the data. If you look at, for example, the fastest growing workforce segment of this country, it's people 75 and older. And most of these people are not people who are choosing, their third or fourth chapter and to live a life of, that's
Mhm.
fruitful and economically flourishing, right? They're actually people who need to work because they can't afford to retire. There are people who realize, in many cases, they're covering health and long-term care costs. But frankly, many of them, worked low-wage jobs and realized at age 65 that actually they still need money to pay for their medications or for other costs that came up, right?
Mhm.
And so, if we believe that we're responsible for our own lot in life, then how did we arrive at a time in which so many people don't have the retirement resources to retire, right? The reality is it's
Right.
not because we're responsible for ourselves. It's because the systems that are meant to support us, they're just not there.
Right. And I guess my fear is that with these potential plans that make a lot of sense, is that if there's a long-term vesting period, that most of today's baby boomers won't qualify.
Hmm.
And we're
Yeah.
going to still have the same crisis turning into catastrophe, um,
Hmm.
even if we have a longer term plan for younger people.
That's right. That's right. I mean, I think that's why alternative financing mechanisms are really critical, and it's certainly an issue that people who design these programs, these experts, grapple with, right? If it is a long-term vesting period, then what happens to today's older adult, right? I think that's part of the financing maze and the puzzle that we live in as a country, and it's, I think there are analogies that can be drawn to healthcare as well, right? Not just long-term care. That oftentimes people encounter they face a healthcare crisis. They don't have the insurance necessarily to cover it. And so what happens to them, right? They incur enormous debt. They often spend most of their lives repaying that debt. And in the meantime, their health doesn't really improve. And so I
Mhm.
think when we take a step back, again, it has to go back to this question of, do we believe that long-term care, and maybe in this instance, healthcare, is a part of the social contract? And if so, how do we finance it in a way so it doesn't create a disparity, as you mentioned, based on age, right? Because there is a huge segment of older adults that only grows more every single day. And so we need that financing mechanism ASAP.
We do. So, how will the CareWorks project influence that? What place or role will it play?
Yeah, it's a good question. I mean, so we are a consulting studio and innovation lab that works with leaders in both the public and the private sector on a wide range of caregiving issues, right? Long-term care issues. And so we offer a few service offerings. We offer advisory expertise on aging, long-term care, the workforce, all of the issues and sub-issues that represent this ecosystem, right? So if you're a public or private sector leader and you need advice, guidance on something that you're dealing with, we can certainly step in and provide that through research, through analysis, through conversation. The second is that we help people design programs and initiatives related to this. So we are working, for example, on PHI's Universal Direct Care Workforce Initiative, which is a multi-year initiative to convert the job, which is currently a low-wage job, right,
Hmm.
into a professional career that's properly compensated, right? Well, that's going to take a lot of mechanisms and policies to get to that point. It's going to take a lot of years and states working together. So we're working with PHI to both support the design of this initiative, but also with the communications and the narrative change work. That's the third service that we offer. So if people are looking on how do you message, how do you frame, how do you build marketing and public education campaigns that relate to caregiving and long-term care, and what does the research show about the best way to message that, we can certainly support leaders in that. And then finally, I think that we're in a place where organizations, whether you're a business or a nonprofit or a foundation, oftentimes you have leadership questions, right? You're a new CEO, you're a board member, you're a social enterprise, and you want to figure out the pricing strategy for my initiative, and we can certainly
Hmm.
help with that as well. I will say the ethos that guides our work is that, it isn't just that the long-term care system isn't working, it's that often the interventions that are meant to support the long-term care system don't work. So our philosophy is let's learn from what is working, let's stop replicating what isn't, and let's reimagine long-term care so that it's modern and then it really relates to how we live our lives
Hmm.
today. Yeah.
Well, I certainly hope you're successful with that. Given that I'm getting older every day. Um, I
Thank
always
you.
end with the same two questions, more or less. And the first is if you're going to make one recommendation to policymakers to improve the situation for care workers, for family caregivers, maybe this is too much in one question, and those receiving care, what would that be?
Well, part of me wants to say what I said already, which is
Yeah.
really a federal social insurance program in long-term care. But since I said that already, I think we need to think about immigration quite differently in this
Hmm.
era. It's a charged issue, of course, in a variety of ways, and we need smart and sound immigration policy that's also humane. But when you think about the demographic needs and you think about the workforce, for example, that will need to fill millions of job openings in the next decade, really one of the only ways that you'll fill those jobs is through immigrants, right?
Hmm.
And we see this through the research. I think 1 in 4 direct care workers currently is an immigrant. And yet, if we approach that issue as a country in a punitive way, and we make it less possible for immigrants to contribute to our workforce and our economy, we're going to really have trouble in long-term care, right? Who's going to take some of these
Right.
jobs? And what we're seeing in the inverse is in Europe, for example, I recently wrote a paper with a professor in Germany about what Germany is doing on this issue. What
Hmm.
they're doing is they've established a social insurance program for long-term care, but they're also seeing the possibilities of proactive kind of workforce, immigration workforce contracts with other countries, right? So they're actually creating these agreements with countries that might supply these workers, to say, look, like we are both facing care needs. What's the ethical way
Hmm.
for us to recruit workers? And can we create a back and forth situation where workers become certified in one of our countries and thus can work in both countries, but you also maybe potentially have citizenship in both countries, right? And that's a very different approach than what you have in the US and in other parts of the world, right? Because they're saying immigrants are an asset and immigrants don't necessarily want to live in a new country. They just want to live financially safe in their country of origin as well, right? And so I
Right.
think we need to explore immigration in a much more proactive, less punitive way.
Really more thoughtful way, sounds like,
Hmm.
rather than reactive as it is now.
That's right.
Yeah. And so then my last question is if you're going to make one recommendation to family members or aging baby boomers, what would that be?
Yeah, this is a great question. I imagine you might have this as well, which is I have a situation where at any given point I have about 5 or 6 text exchanges going on with people in my life about their family caregiving issue, right?
Hmm.
And they're either
Hmm.
people I directly know or they're people who have been referred to me, and I'm happy to sort of guide them through because it's a maze when you're dealing with it personally. And it's often fraught with grief and confusion, right? When my mother needed um, to move into a nursing home, my father went through, I don't know how many pages of paperwork and regulations in order to be able to qualify for her at a time in which he was grieving the reality that his wife was no longer going
Hmm.
to live with him, right?
Right.
And so my one recommendation that I give to whether you're an older adult, a person with disability, or a family member is that there's no script to how you manage your own caregiving needs. There's no proper way of aging. There's no you must do this and you must not do that. Every situation is unique and different. And yet what we have is a long-term care ecosystem that doesn't properly support you and is designed in such a way that it looks more like a maze than
Hmm.
an ecosystem, right? And so what
Yeah.
you're facing is the confusion of a system that isn't designed for you. So it's not you. Oftentimes people will feel like, I just need to figure it out. And the question is, well, you won't figure it out. You'll figure out the best way forward for
Yeah.
you or the person you're dealing with. But what needs to be figured out is at a higher level as a political question, right? And so I would say, give yourself a break, realize there's no script. When you run into a wall, that wall has been placed in front of you by someone else, and do your best. And realize that we all play a role in who we elect and how we design our systems. So make this a priority for you next time you're talking to an elected official.
That's great advice, and might kill two birds with one stone. You do that.
That's right. That's
So
right. If we can change,
help you and help the system.
that's right.
Yeah. Good. Thank you very much, Robert. I look forward to watching how all this develops as you proceed.
Thank you, Harry, and thank you for this podcast and for the opportunity to speak with your audience. It's been a pleasure.
Thank you for listening to my discussions with experts about the challenges facing the United States as our population ages, along with possible solutions. You can visit my blog on these topics at okboomer.substack.com. And if you have questions, comments, or suggestions for other topics or speakers, please email me at harry@margolis.com.